pharmacist from Portugal. I work for the past 4 years at the Institute for Evidence-Based Health, where I'm the executive director and senior research director. We perform studies, and my role is actually in real-world evidence and outcomes research studies. Before that, I spent 20 years at the Portuguese National Association of Pharmacies, where I led the pharmacy services unit and later on the research unit of ANF, responsible for developing services and evaluating them, including the first vaccination, so the first flu vaccination service that my team and we implemented in 2008. So our learning objectives for today, I hope you can gain some insights on the epidemiology of vaccine preventable respiratory diseases, especially in older adults and at-risk patients. And we appreciating the expanded roles of pharmacists in several new areas of vaccination for this subgroup of population, and also discover or at least remember some compelling arguments to ensure uptake of vaccination and increase of coverage so that patients are aware of the vaccination benefits. So I'll begin by setting the scene very briefly, then go through the target population that we are discussing in this presentation or in this session today, some of the evidence and some of the things we know about pharmacy-based vaccination, and then, of course, close with the benefits and the importance of vaccination literacy and how pharmacists can play an important role. Some of the major respiratory disease infections have an impact or a major impact in vulnerable populations. And this includes not only, but includes the older populations. And you can see with this slide, I tried to show you some of that impact in this subgroup. So the death rates in influenza, a respiratory disease, so in flu, in pneumonia, in COVID, and also in the respiratory syncytial virus, they have a huge impact in this particular subgroup. And while we are more familiar with flu, of course, and then COVID, and now pneumococcal vaccination, I also would like to draw your attention to the RSV, because this vaccine has just been approved for the first time by FDA and the European Medicines Agency for the older adults. So I think it is important for FIP and for all of us pharmacists to keep in mind that we also need to develop efforts in involving pharmacists to deliver this vaccine in the next months and years to come, and generate the evidence around this. So what this slide shows us is throughout times, and between 1880 to 2020, you can see that the timelines for developing the vaccines have been shrinking. This is remarkable from an innovation perspective and from ensuring a more rapid access to vaccine. And I think we can all see the major effort that has been made in COVID. We all witnessed that we could in 1 year develop a vaccine to mitigate and so the impact of this epidemic. With this identifying patients or eligible population, it very much depends and follows the guidelines of each country, of each health authority. And it may vary according to vaccine and according to each country. So there is not a, it's when we speak of older adults, the minimum age may differ from country to country and from vaccine to vaccine. So it's not the same. And it's very important that pharmacists follow to those guidelines so that their efforts are aligned with the national guidelines in doing so. And usually, of course, the most vulnerable populations are the most relevant, older adults, not just the older adults visiting our pharmacies, but also those in residential care and nursing homes. And then, of course, it is very important, although this session is focused on older adults, we must not forget at-risk populations for certain vaccination, which creates a huge range of opportunities for the population subgroups that pharmacists are able to reach, and not forgetting, and this is very important, they themselves as pharmacists, because it is very important that pharmacists themselves are also included and are part of the movement to vaccinate themselves against seasonal vaccines such as flu, to protect them, to protect the team of the pharmacy and their patients. The flu vaccination is, of course, one of the most relevant for when we talk about pharmacy-based vaccination. This is a map of a study published that shows in Europe which countries are now able to provide vaccination, flu vaccination, either through pharmacists or employing other providers. And I just wanted to take a moment to share with you our Portuguese experience. So we learned in 2008, our team went to the United States to learn with American pharmacists who were doing this since the 80s. And so we actually modeled our training and our resources and all our strategy from the US model, the training model, which was accredited, which was and still is accredited by the CDC. And our experience in 2008, when we enrolled pharmacists, that we started from zero, and in 3 months, we reached 48% of community pharmacists all over Portugal being certified, trained and certified to provide vaccination for flu. And this experience and tools were then used by other European countries, such as Ireland and Switzerland. Our colleagues have approached us, and later on by FIP when developing the kit for the toolkit for the entire world. This was a study my team performed for the pharmaceutical group of the European Union on when we had to assess the interventions provided by European pharmacists on COVID. And so the COVID pandemic has created opportunities for pharmacists to expand many roles, including COVID vaccination in at least 8 countries by June 2021. So this number is slightly increased now, with more joining later, including my own country, which will provide, where pharmacists will provide COVID vaccination this fall for the very first time. I also wanted to take a moment to share one study I found. There are not many studies on the evidence on pneumococcal vaccination, but pneumococcal vaccination is a very important vaccination in older adults. And it is important that we are also able to engage pharmacists, community pharmacists, in providing this vaccination for older adults. And it has an enormous benefit. Usually it's not an annual vaccine, but it has a huge impact in decreasing the mortality rate, and there is a huge benefit. And this study shows exactly this. So you can see that the intervention group, including pharmacies, there is the patients in this group have higher odds of receiving a pneumococcal vaccination. So nearly twice, if you see the adjusted odds ratio, so 1.91 versus the control group. So this is, then the pharmacies account for a very important variation in this outcome. So this is a message to invest in this group, in this vaccination, but also in providing, in performing research demonstrating the value of pharmacy vaccination in pneumococcal vaccination. It's not just all about flu or about COVID. Next, my last point is talking about the compelling arguments for pharmacists to be advocates for providing trustful information on vaccines to patients, because there is an issue of mistrust in many people and in many countries, and even in jurisdictions with advanced economies. And so there is an important role pharmacists have to play with compelling arguments. I find this slide very powerful because what you can see is the impact of vaccines when they're first introduced in several areas on death rates. So you can see clearly in many of these infection diseases, the decline on mortality when vaccines were introduced. This is a huge compelling argument to convince not just pharmacists themselves, but also the patients they counsel. The vaccination health benefits, it's not just about death rates, and it's not just about protecting the individual health. And this is also a very important argument. I think it's important pharmacists are aware of. There is a collective social benefit in high vaccination coverage due to herd immunity. So it's not just about individual health protection. So when you vaccinate, you're not just protecting that particular individual, but when you do reach a certain number of people and that get immune against the disease, when that number is reached, such as the disease no longer persists in the population, then you reach herd immunity. Of course, herd immunity is very different from vaccine to vaccine. So it is important to say that it's not the same for every vaccine. There are deadly diseases that require a very high number of population to be vaccinated. You know that, and respiratory diseases require a lower number, but still the message here is the important effect conferred to the community as herd immunity sometimes may not be reached, but we have to do our best efforts to increase. And I think this is also a compelling argument for pharmacists to use. So there is a problem of mistrust in vaccines. We all know that. So in this slide, what you can see on the left slide is the share of people, of respondents in a very important study performed worldwide on the safety of vaccines. So you see there is an issue in countries colored in darker colors, dark blue colors. There is an issue, people not trusting the safety of vaccines. So vaccines are highly safe. We all know that. Or at least we should know that. And there is a huge problem in some jurisdictions in terms of trusting safety of vaccines. But it's not just about safety. There is also an issue of trusting that vaccines are actually effective. On the right hand of your slide, you can see that in pink, in dark pink, the countries that have most issues in trusting vaccines. And this is very relevant because it's an area where pharmacists can also provide trustful and reliable information based on science and not on beliefs, so that we can really educate people and increase coverage in vaccination. So in a nutshell, what I wanted to say is that the role of pharmacists that can play is in vaccination, of course, but then, as we've seen, in providing reliable and trustful information on vaccines. And last but not least, very important, and although vaccines are safe, as we have stated, pharmacists have an obligation, being the experts on medication, of reporting adverse events, and we would like to see pharmacists reporting adverse events, not only for vaccines but for any other medicines, to their national health authorities.